definition of shock. Y'all know there are different types of shock, yes? Did y'all go over that?
Yes.
You should have the dysphonia. I think I have the slides coming up. Seizure, that's a brief loss of consciousness. It's accompanied by eye or muscle fluttering or convulsions. Respiratory failure, the definition is the inability of the lungs to perform ventilating functions. We have two types of respiratory failure, acute and chronic. Acute is the impaired gas exchange process or airway obstruction specifically, while chronic is the disease process that impairs breathing, like emphysema or pneumonia, things like that. Cardiopulmonary arrest, we should know what that is. The sudden cessation of productive ventilation and circulation. Is cardiac arrest the same as a heart attack?
No.
Why am I asking that? Because that's a question I've seen come up. What is a heart attack?
Blocked artery.
It's a blocked or clogged artery causing a lot of pain. Whereas a cardiac arrest is what? You're dead. The heart stops. When your heart stops, you're considered clinically dead. We can bring you back to life with CPR, but the arrest means you're dead. Heart attack is just the pain due to blockage. Please remember that. What's another term for a heart attack? Can't talk. Myocardial infarction. What's the initials for that? MI. Have y'all seen that come up before? MI? Myocardial infarction.
Yeah, it was on your test.
It was on the test.
Yeah, I missed it.
All right, stroke once again, guys. Interference with blood supply to the brain as a result of occlusion or rupture of a cerebral vessel. We have two types of strokes. We have hemorrhagic strokes and ischemic strokes. Hemorrhagic is the pooling of blood outside the veins, like you see on the left here. Ischemic is the rupture and bleeding in the brain. Usually it's accompanied by a clot. So one is free-flowing out of the veins, while the other is causing a blockage. That's the simplest way to go with hemorrhagic versus ischemic. Two main types of strokes. Something you'll learn a lot more of in CT and MRI, but something we still need to know as far as medical emergencies.
Sorry, sir, the ischemic is the difference between ischemic and hemorrhagic.
Hemorrhagic is blood flowing outside the vessel. Ischemic is a blockage. That's the easiest way to remember those two.
You see the picture showing me?
And by the way, I just realized these are backwards on the descriptions. It doesn't even accompany the picture. These should be shifted around. So if you took a picture of that, please make notes. I apologize. Hemorrhagic is the rupture and bleeding to the brain. Ischemic is the blockage. See how it doesn't match the pictures?
Oh wait.
That's why Google's dangerous. Don't rely on Google, guys. Case in point. All right, here's the different types of shock. This is the same PowerPoint I believe y'all had with dysphonia. 4 types there: hypovolemic, cardiogenic, neurogenic, and vasogenic. Please know the difference between those 4. Hypovolemic is blood or fluid loss. How can you remember that? Hypovolemic, volume is like a volume of blood. You're losing the volume of blood. Blood or fluid loss. The volume's going down. Cardiogenic. Cardio means what? Heart. Can't pump enough blood to meet the body needs. How does the body pump blood? With the heart. That's cardiogenic shock. Neurogenic, low blood pressure and a slowed heart rate. How does the heart beat? Through nerves transmitted to the brain. What's neuro mean? Nerves. Neurogenic, nerve shock. My heart's slowing down. It's not getting the right signals. Is that helping?
Yeah.
I'm trying to give y'all some little clues there. Vasogenic shock. Inadequate tissue perfusion by oxygen-carrying blood vascular system not contracting properly. I don't have a trick for that one, but know that verbatim for vasogenic shock. Something to do with the veins and the arteries, by the way. Vasodilation, vasogenic shock. I guess there you go. Oxygen-carrying blood vascular system, vascular vaso. Here's your clue. There's another big type of shock that we talk about a lot that I want us to make sure we know. I think it's on the slide, but just in case you don't know which one I'm talking about, it starts with an A. Anaphylactic shock. That's the most common type of shock that we have in radiology when it comes to a reaction to contrast. Please write that down. The most common type of shock that occurs in radiology due to a reaction of contrast is anaphylactic shock. You will see that again.
It's a type of vasogenic.
It's a type of vasogenic, you're correct.
It's the most common.
It's the most common type of shock in radiology due to contrast reactions. Anaphylactic shock.
Oh, that's,
And there you go, yeah, speaking of. Anaphylactic shock, that is a type of vasogenic, most common type in medical imaging. May occur with contrast media administration due to allergies. So we're gonna monitor, and of course what we do, call for help, alert physician, stop the procedure immediately. Please know that, guys, that has been coming up a lot. Anaphylactic shock.
They also call the vasogenic shocks.
It's a type of vasogenic shock, and the most common we see in radiography in medical imaging.
And deals with the vascular system.
Pretty cool.
yeah.
Hey, you got a 3-day weekend at least, yeah? Hey, it's an extra day to study though. Yeah, look at the positives. Okay, once again, guys, like we've talked about with contrast, those range from mild to severe. Most severe is going to be what results in death from cardiac arrest. And once again, what's cardiac arrest?
Death.
It's death, cessation of heart. It is death or the cessation of heart. Cessation of heart. That third hour, I can't talk by the third hour, man. My goodness.
So we write cardiac arrest as cessation of heart activity.
Yes, not the same as a heart attack, which they'll have that as an answer choice sometimes.
Would that be a cardiogenic shock?
Not necessarily. Heart attack and shock are not the same.
So is it called, what is spice of ischemia?
A little bit more on those reactions, guys. We had this on Tuesday, but good to repeat. What are some mild reactions? Itching, urticaria. By the way, that's another word for hives, urticaria. And of course, the nausea and the vomiting.
What's the other word for itching?
Another word for itching? What is it? It's escaping me. You remember the name for itching? It's escaped me.
Mozzie?
Is there another name? I always.
There's another name, there's a scientific term for itching. I just can't think of it off the top of my head.
Well, they're Googling it.
Question?
Diaphoresis isn't one of them, sweating?
It is. It's just, it's not listing all the same ones we had before. Sweating is definitely a mild reaction. Serious reactions, of course, laryngeal edema, we went over that, shock, cardiac arrest. If cardiac arrest does occur, do you stand there and stare at them?
Yes.
What do? You immediately call for help, activate the emergency response system. What's the emergency response system? You begin CPR. When you begin CPR, you always begin by calling for help. Check the pulse, check for responsiveness, and then you immediately begin compressions and breaths as needed.
It's pruritus or rhitis?
Thank you, pruritus. Look at you.
How do you spell that?
P-I-
I'm sorry, I didn't hear you.
R-U-R-I-T-U-S.
Excuse me, I was gonna spell it.
Bill.
Yeah, I'm taking his glory.
What is the compression rate for CPR currently? 32. 30 is the
100.
compressions, 2 is the what?
To equal 100.
The breaths.
In a minute?
So you need to get to 100.
There you go.
Minute?
And it's S over
I'm pretty sure.
It's 30.
Systolic over
30
diastolic,
per minute.
yes.
No.
All right, diabetes.
30
Yeah.
for two breaths.
Oh, 30, that's 30.
Our healthy patients are going to be in control of their insulin production and excretion to meet carbohydrate demands of the body. This is what we're dealing with diabetes. If we have someone who's hypoglycemic, that means they have excessive insulin in the body. Their conditions are often hunger, being weak and shaky. They sweat a lot, diaphoresis, as we said, as Jay said. Being confused and irritable, and of course aggressive or hostile. Those are all normal behaviors for someone who's hypoglycemic.
They be hungry.
Diaphoresis is what?
Be hungry.
That's sweating.
Okay.
I get hangry.
And then I always get confused with the words hypo and hyper.
Hyper is too
Which one
much.
was, hyper is like over and hypo
But I guess for this
is
one.
less.
Well, no, cause hypo, this one is excessive.
That's excessive insulin, not excessive
It's just
sugar.
insulin, not, yeah.
Hypoglycemia, that is low blood sugar,
Low blood sugar, which equals excessive
excessive
insulin.
insulin.
Correct.
The insulin decreases.
That's a good thing to write down, because that can be
Oh, I mean,
confusing.
no,
Did you get that?
Mhm.
Glyco, like glycemia, that's like for the sugar. Glyc,
Glucose.
Sugar.
like glucose.
So excessive insulin, but low blood sugar.
This is low blood sugar, which equals excessive insulin.
Decreases the blood
But is
sugar
that
level,
how it works?
that means they have too much of insulin, cause their sugar levels.
And there's the other one, guys, hyperglycemia. Hyper means a lot, excessive sugar. So they're low on insulin, they need some insulin,
That's type 2.
typically, yes. Their symptoms being thirst, urge to urinate, dry mucosa, rapid breathing, drowsiness and confusion.
Diabetes, that's fine.
They have things,
I'm back to us, Monson.
So can I told you this thing.
Yeah, that's how I remember, I don't know why,
So
but
what's the hypo and
hypoglycemic,
hyper?
the symptoms remind me
Hypoglycemia
of
means
someone
low
that's
blood sugar,
homeless.
thus excessive
And
insulin.
What?
hyperglycemia reminds me of someone that's
Hyperglycemia means too
pregnant.
much
I
sugar,
don't know why.
plus low insulin, they're inverse.
So the hypo is
I'm talking about the
homeless.
prefix,
Yeah.
like what is the?
And
Someone
hyper-
that's
Hypo
homeless,
means
and
low.
hyper is someone that's pregnant.
That's messed up.
So
That's
hypo
messed up.
means low and
I don't know
hyper
why,
means
cause
low.
they're hungry,
Yeah.
they're
Okay, so
irrational.
hypo.
They're
Both of-
sweating because they're outside.
Yeah,
they
both
don't
of
have a
them
home.
are hungry. Both of them are
They're,
irrational.
they don't have a shelter, so they're
Hyper
hot,
is too much
sweating.
sugar.
Okay, guys, just good to know CPR. I mean, I'm
Keep going.
assuming we all know what this is, but just in case,
Oh,
it's
camera.
our
She got you.
life-saving
4K.
emergency response. If someone is non-responsive when breathing and heartbeat